Photos from one Detroit area hospital show just how bad the coronavirus pandemic has gotten in the city. The photos show bodies stored in empty rooms and piled on top of each other in refrigerated units. Now, we do want to warn you, some of you may find these images disturbing. Ryan Young reports.
I can tell you over a few days, my team and I have been working on this. We've been talking to healthcare professionals throughout the Detroit area, and it was at a couple hospitals where we were getting some information from them about some of the conditions they were working in. Now, we'll show you some of these photos. This was during a time when there was an influx of patients, and obviously this entire area has been hit very hard by COVID-19. What some of the professionals inside the ER were telling us that basically at some point they were overwhelmed. There were patients dying in a hallway. They also had so many bodies they didn't know where to put them at one point. And you can see them in this one room where it's a sleep study room. They've placed them in there for a period of time. But it's the freezer room that really caught our attention, where you can see the bodies stacked on top of each other. I can tell you some of the staff there became so upset they started reaching out to us. They didn't think there was enough preparation put in place to make sure they were able to absorb all the people they were seeing. The patient ratios were also off. They had a lot of nurses and not enough nurses to the patients. And so we'll show you the freezers from the outside. We know they had to order more freezers. So they had 5 freezers to be included on the outside to have all the patients that they were receiving. At this point, the hospital says they surged more staff. They've added more freezers. But you could tell the toll on the staff themselves. They were very upset talking to us over a several-day period saying more needed to be done.
There's a new test for diagnosing coronavirus, and all it takes is a little saliva. The FDA granted an emergency use authorization for the saliva test, which was developed by Rutgers University. It requires a person to spit several times into a tube that is then sent to a lab to be tested. Now, that's different from the current test, which swabs the patient's nose or throat. At this time, the saliva test will only be offered by clinics and hospitals that are associated with Rutgers.